So I am super excited to share this interview with you. A couple weeks ago, I sat down with Dr. Travis Love. We talked about all things testosterone and hormone replacement and side effects and men versus women and pretty much everything that you need to know. And it's all based on questions you guys sent me, so thank you. And if you like what you see, hit like, hit subscribe. Stay on this channel for more good shit. All right. Enjoy. My name is Andrew Stephen Rose. Welcome to the show. For years, I've been known as the gym guy. This show isn't about the gym. Some of it might be, but most of it, it's about business. It's about health. It's about your life, your relationships, and optimizing all of it to be the best you can be.
So I put a post up a couple weeks ago asking if you guys would like me to talk about testosterone. Well, I know a little bit about testosterone because I've used it for quite a few years, but I think it's a little bit better to sit down with somebody who knows all about it. So I'm going to introduce Dr. Travis Love. He's going to give you a brief intro into who he is and what he does, and then I've got a couple of questions that you guys have sent to me, and we're going to go over those. So, Doc?
I appreciate it. So I'm Dr. Travis Love. I'm the medical director at New Logics Wellness and Medical. You may have heard my name around town. I've been here for a little while now, and we're over on Houston Northcutt. I've worked with Andy now for, God, how long has it been?
It's close to 10 years.
God, has it been?
I moved here, 10 years ago, December, 9 years ago, I think.
All right.
So it's all blend together at this point.
So what questions were there?
First and foremost is there's a lot of taboo around hormone therapy and TRT and testosterone, and people have their mixed feelings about it. But I think first thing is if someone's displaying some symptoms of low testosterone, and maybe they've got a partner that's like, hey, you should go get some stuff checked out. Like, what would you say to the partner that's resistant to go seek medical help?
What are you afraid of? I mean, honestly, that it comes down to, is it a point of pride? Is it something that you know internally something's off and you're afraid of what the answer might be? We've had guys that have come to us after really having to struggle with this for years, and they always say, I was ashamed to come sooner. I felt like I wasn't enough of a man if I had to be seeking medical assistance. It was just not something that I was supposed to have to do. But invariably, these are the guys who always say, I wish I'd come years sooner.
I wish I would have done sooner. Makes sense. So what, I guess on that note, what are some negative effects of living with low testosterone?
Oh, well.
Like, how does it negatively affect your health?
So there's so many different receptors for estrogen and testosterone in the body, and the number of functions just keeps going up that we're discovering. But everybody's thinking about testosterone just as libido enhancing, erectile function improving, and muscle building. And that's at the bottom of the rung. Let's start at the top. So once your testosterone dips below somewhere in the range of the 700s, 800s, sleep's not as restorative as it used to be. You wake up, you feel like you could still use another hour, maybe two of sleep. You got to get yourself up, make yourself get going. Short-term memory's not as sharp as it once was. You may have some foggy thinking, small things like, where did I put the mail? Did I get the mail when I came home? Did I turn in the keys when I left work today? Did I shut off the hose when I came in from the yard? And as testosterone continues to decline, we begin to see that once it gets into about the 500 range, which is kind of halfway between what they claim to be normal range, and of course normal is based on ages 18 to 80, and you got to keep that in mind. And we're cutting off the upper percentage and the lower percentage, and so what they've established as normal, depending on the lab, is somewhere between 200 to 1100. All right, well, If you come in at 400 and you're 35 years old, I'm sorry, no matter what your doctor told you, that's not normal. When 1100 is the top end of the range, and you might have an 80-year-old in that range, no. It's not normal at that age to be that low. So once testosterone drops below about 500, fatigability goes up, your ability to generate new muscle goes down. As you lose muscle, your metabolism slows, so your weight begins to creep up. These are broad generalizations. It may not hold true for 100% of the people. So as muscle mass goes down, metabolism slows, and weight goes up, what happens? Insulin resistance can begin to build. Insulin resistance can lead to eventually type 2 diabetes. Type 2 diabetes is a known risk factor for heart attack and stroke. As a matter of fact, we're trained to treat diabetics as already having had a heart attack. That's just how destructive it can be. Then let's talk about elevated cholesterol and elevated blood pressure from increased body fat. All of which we know increase what? Your risk for heart attack and stroke. So let's top that off with now you're tired and you're less physically active and you're gaining weight and you're at an elevated risk for heart attack and stroke, and now you're irritable. Because just because testosterone has gone down doesn't necessarily mean that your estrogen has gone down. And as we begin to lose testosterone and its balancing effect on our estrogen, we become more emotionally sensitive. We haven't had to deal with that in years. Things begin to get under our skin more than it should. We even know that shouldn't have ticked me off the way that it did. And now you're aggravated that you're aggravated. So, by the time guys are experiencing erectile difficulties, everything else has already slipped. And by the time that they present to their primary care provider and they're into a range that the primary may say, well, you're a good candidate. Well, you qualify for testosterone replacement by insurance standards because you're in the 200s.
Right.
Well, you may be 80 pounds overweight, a raging diabetic. You may have already had your first heart attack, and then they'll tell you, but you're not a good candidate. So the bottom end of the equation is what everybody thinks of when they think of testosterone replacement, right. But it's neural function, memory, decreasing your risk for Alzheimer's and dementia, maintaining lean body mass, and eliminating a lot of what we consider age-related decline, which essentially is hormonally related decline.
So is there, I think we're talking about men, mm-hmm. but is there a comparable, medical reaction, health reaction with females?
There is. As a matter of fact, if you look at the amount of testosterone that a woman is normally exposed to, because their hormones fluctuate much more than a man's does, but a woman over a 1 month period of time, quantitatively, may be exposed to more testosterone on average than she is to estrogen or progesterone. I haven't done the calculations myself. This is just something that I've heard thrown out in lecture before. However, testosterone is one of the first hormones that begin to decline in women. And it has all the same functions in a female that it does in a male. They don't require testosterone to the same degree that a guy does, but with the loss of testosterone becomes fatigable, doesn't generate muscle as strongly, libido can go down, becomes more emotional. Estrogen has a tendency to centralized fat deposition on the thighs, the abdomen. Women, both men and women, require testosterone to a greater or lesser degree. But at the end of the day, making sure that you're properly balanced is the key.
So it seems, obviously there's a ton of benefits to testosterone therapy.
Yeah.
Are there any side effects?
Well, of course.
To testosterone therapy. And
just like anything else, too much of a good thing is a bad thing. So if you party too much, it's going to catch up with you. If you use too much testosterone, it's going to catch up with you. So overdoing it on your dosage, not following physician instruction, can lead to estrogen excess, which can cause, a waning of the improvements that you've begun to experience with testosterone. Fatigue level goes up. You can get prostate enlargement with excess estrogen. Estrogen in a guy should never go above 40, but you require estrogen to maintain good joint health and cardiovascular health. So if you crash your estrogen, you've got problems as well. So too much, too little. It's a double-edged sword. If you are properly following instructions, the only thing that I worry about with testosterone replacement, and it's usually with guys because they require a lot more than females, is there's about 25%, maybe 30% of the population that will respond with an overproduction or an accelerated production of red blood cells and hemoglobin. We'll see this coming in advance. And as long as you're staying consistent with your follow-up blood work, as long as you're coming in and allowing us to adjust your dosage and you're being honest with what you're doing, then we can prevent most of the possible consequences from an overproduction of hemoglobin hematocrit. What does that do? It could thicken blood and increase your risk for heart attack and stroke. So that's where everybody is getting the information, myself included in medical school. Testosterone is bad. Testosterone will kill you. Testosterone will cause a heart attack. It's going to cause a stroke. You're going to get a blood clot and die. Well, that's from poor medical management or poor compliance. At the end of the day, if lowering your testosterone, you still respond with an overproduction, donate a pint of blood once every 2 to 3 months.
That's literally what I did before we filmed this, is I came in because Doc's been hounding me for the last couple of weeks because my hemoglobin is too high. So It's one of those things where having a physician that's looking, whether you are in it for the therapeutic part of TRT, right? Mm-hmm. Or you're a competitive athlete and you're competing in a non-drug tested sport, mm-hmm. and you're using it for you're getting more into PEDs, performance enhancing drugs. Now, in full transparency, if I'm doing a bodybuilding show, or I'm training for a powerlifting meet, mm-hmm. and I'm going above and beyond what Doc has prescribed for me, which I'll admit that I do, but I also always tell him what else I'm doing. And the only reason I do that is so my care is appropriate to that. Because if I come in and say, yeah, I'm just doing my dose, and my numbers are way off, like I'm putting myself at a tremendous health risk. Now, if there's one thing I wish I knew at the time that I started using testosterone, was how to manage it, because I didn't. And it was one of those things at that period of time, it was very taboo. Nobody talked about it. And it was like sort of the gym thing, right? And then, it's one of those those learning experiences. So having known that, coming to Doc now for going on the better part of 10 years, one of the most important things, and this is another question that came up, when you are looking for a physician to manage your care, what are some things that are important to ask? What are some things that are important to look for in your provider?
That's a good question. I think you want to look for somebody who has not just a residency training and a board certification in a specialty. Even if it's a specialty that should be able to, at least superficial level, address your hormones. We don't get trained to address hormones, not at the level that we're talking about. You need somebody who has gone above and beyond, who has sought out additional certified training for optimizing hormones, because there is a difference between optimal and normal. And optimal is far different than normal. I mean, 200...
I'm going to stop you for a moment and repeat this. There's a difference between optimal and normal.
Yeah.
That is really important. And I think my first experience when I moved to Charleston, I went to a GP. Mm-hmm. And I've told this story so many times. This guy looked down his nose at me, pulled this glass, you know, it's one of those doctors who wears glasses down here, looked over his glasses at me and said, why would you take testosterone? Because he's looking at my blood work. And I was in the normal range. But I was saying, Doc, I feel like shit. I think my testosterone was like 400 or something at the time. I mean, it's in range, sure.
Well, go ahead. And I've got.
But it was just really. I'm going to let you talk and say more. But it's really important to take away. Like, there is a difference between normal and optimal.
The caveat to that is everybody talks about total testosterone, which makes, in my opinion, jack in the way of difference. What they really need to be talking about is free testosterone.
What's that mean?
Free T is your non-protein bound testosterone, the only biologically active form of testosterone that you've got circulating in your body. It's the only form of testosterone that can affiliate with a receptor and give any sort of stimulation to it. So you can jack your testosterone through the roof, but you've only got a limited number of receptors. So once you go beyond a certain level, the only thing you're doing is either generating dihydrotestosterone, which can cause hair loss, or you're generating excess estrogen, neither of which you want. But if sex hormone binding globulin is high, I don't care if you've got a 4,000 testosterone. If your sex hormone binding globulin, which is just a protein that's made by the liver, is high enough to absorb all of that additional testosterone, you still may have the same free T level as a guy who's got 400 T, even though you're 4,000. You're still going to feel the same. So you need somebody who knows how to comprehensively look and evaluate. Otherwise, you're going to walk away nonplussed. You're going to walk away feeling the same, or you're going to be told, there's nothing wrong with you. That's just part of getting older.
I hate that one. I actually had someone in this recently, with someone that I sent to you. They had that exact experience. Their physician said, well, you're getting older. It's normal. Like, you're going to slow down.
It's God's planned obsolescence. I mean, if you want to be ready for the junk pile, then that's fine. But if you want to be optimized, then you've got options out there for yourself or someone you care about to be seen.
So one other question that came up was, you know, in that process of looking for a provider, how do you, I guess, what else do you provide? Obviously, we're talking about testosterone, but what other services do you provide the most with your clientele?
So, you know, we try to be very comprehensive. I get 9 pages of lab work. I've got negotiated preferred pricing with Quest Diagnostic. They do the largest number of hormones in the United States, as far as I know. Very dependable. I never have to repeat my blood work, not unless somebody has been disingenuous with kind of what their dosing was. Don't smile. Because I'll call them on it real quick.
He has.
But we do preventive health care for some people. Some people, after I look at their labs, you know, their testosterone's not bad. They're still in their reproductive prime. They're looking to have kids. They've got a high sex hormone binding globulin. And I start looking at thyroid function, vitamin and mineral deficiencies, lifestyle, and we do coaching. And we try to work to maintain fertility, drive down sex hormone binding globulin, free up testosterone, get them feeling better so that, you know, we're addressing their primary concern, but we're also preserving what they've already got and maybe optimizing a few things along the way. We do men's and women's sexual wellness. We do preventive health care. We do minor cosmetic procedures here in the office. I mean, primarily, when I first got out on my own, that's what I was doing, was minor cosmetic procedures, and I actually taught for Galderma Corporation, which manufactures Dysport and Restylane. They flew me around the country teaching. So that was my first love, and this I kind of came into on the backside of things. And the amount of difference that we're able to generate for both men and women who come in, and they've got an open mind and they're willing to take some advice. It's been life-changing for so many people. It's restored my enjoyment of the practice of medicine.
That's huge. I mean, it's a completely, again, having had a bad experience with a physician, and then knowing your approach to it now, to me, it's worth every penny. And another question that I got was what's it cost? Like, if I'm going to come to you for TRT, like, what am I looking at spending?
That's going to vary based on a couple of different things. The plans that you choose to get involved with, the tier within the office that you come in at, but at the lowest level within the office, if you're doing just basic hormone replacement therapy and nothing else, it's going to be the equivalent to or less than probably what you're paying for a family cell phone bill.
That's not too bad.
No.
And I guess how, if you're going to see a physician, or maybe you're not seeing a physician and you're taking testosterone on your own, how often should you get your blood work done?
Once every 3 months. Even the indications by the College of Medicine is, 6 weeks, 3 months, maybe again in 6 months if everything's good, and then you can go to once a year monitoring after that. No, you can't. There are too many things that can go wrong in the meantime, and you'll wind up with bad outcomes.
So I guess let's wrap it up. If there was, if someone was in front of you and they were on the fence,
yeah,
and they've got some notion in their head that they're fine, and they're telling you the symptoms that they're having, and through your experience, like, something's off here. What do you say to them?
Phrase that one more time.
So you've got a patient in front of you,
Yeah.
and they've heard all their life, maybe like, people who take testosterone are cheaters.
Gotcha.
Right? Because they see it only as like Jose Canseco steroids in baseball.
Yeah.
But yet they're presenting symptoms that are easily treatable, very easily managed and easily treatable, and they're going to feel better, the whole 9 yards. How do you bridge that gap?
Well, I guess probably the most direct way to think about it is, if I told you you were diabetic and you're going to lose your feet, would you turn down metformin?
Yeah, pretty much says it all.
It's a let's get real here. This is a medical problem. You are experiencing legitimate symptomology that has a diagnostic criteria and a medical treatment. So when there's something out there that can give you back what you worked so long to achieve, and now you've finally gotten there and you can't even enjoy the life you've built for yourself, why would you turn it down?
That's a great question. So regardless if people are local in Charleston or somewhere in the country, how can someone get a hold of you? How can someone get an appointment with you?
It's real easy. Just give us a call at 843-818-3800. And we actually have patients. We're in a unique situation. I've got a national account, so we can order labs in all 50 states, which is a rarity. I've been blessed in that situation. So we've got patients all the way from the West Coast all the way to the Northeast. And I've even got a couple international patients that we treat. So as long as you can make a trip in to see me once a year, or you've got a primary care provider who can update your physical exam and your medical history and send me a copy, we can do most of what we need to do by telemedicine, not per se telemedicine. We're going to have your labs ordered. We're going to need somebody to get a copy of your vitals. But most of what we need to do can either be done by telephone, or it can be done with an online meeting.
Love it. It's perfect. All right, guys, so we're going to wrap it up. If you have any other questions, make sure you shoot them to me. If we can answer them, we'll send the answers your way. But hopefully you had some value out of it, and I appreciate your time, Doc.
Thank you. And thank you all.